Hello, everyone. My name's Sandy Schneider. I am a past president of SAEM, and it is my delight today to introduce this session on the Navajo Nation. And our speakers, Vic and Totten and Mark Oswald, will be back with you as soon as we view their presentation.
Hello, this is Vic and Totten talking with Mark Oswald about COVID on the reservation, what the Diné can teach the Bilagana. The Navajo suffered from a major COVID outbreak early on with a larger number of people infected and deaths than anywhere else in the United States. And yet now they have one of the lowest new infectivity rates in the country. How did they do that? What lessons can they teach us? The Navajo typify what we would think of as hyper-rural and poverty-struck populations. The poverty rate's about half, about 50%. Unemployment statistics suggest that maybe 10% of the Navajo are unemployed. Others range to 70%, but the range is so wide because most of the Navajo are not looking for work. A large percentage of them live outside the usual monetary economy. Chronic illnesses have blossomed in the last several generations. Obesity has gone up to some 80%. 30 years ago. We just lost audio.
Sandra just lost audio.
Well, then, if we can't continue on it, I can say that diabetes, cardiovascular, hepatic, and renal diseases are very prevalent. Go for it. Substance abuse turns out to be a little bit less common than outsiders think. The average Navajo actually doesn't drink, but the ones that do drink show up in the emergency department more often than the average person, which is true of populations all over. Trauma, on the other hand, is more prevalent with 9,000 miles of unpaved roads and mud that turns amazingly slippery when it gets wet, with people riding horses, herding cattle and sheep. There's a lot of trauma, but like many other populations, they're pretty tough. And a lot of trauma that we in the rest of the United States would bring to the emergency department stays home in the Navajo Nation. With all of that, the life expectancy is some 5 to 6 years shorter than the US average. Can we go to the next slide? What if you click the double go ahead button?
I hope that just speeds up the loop. So this is locked. It's going to have to be reloaded.
Do we have
Sandra, raise your hand if you can hear me. Okay. The slides are not moving and there's no audio. We could do audio ourselves, but we need the slides.
Just hold on a second. We have Dan trying to figure it out.
I do have the whole thing here, and I could maybe share my screen.
Just give me 1 minute, guys.
I'm sorry?
Give me 1 minute. I'm just going to get the slide up again.
In the meanwhile, I can say that Dr. Oswald and I will be sharing some of the lessons that we have learned from the Navajo response to the COVID epidemic. The Navajo typify what we would think of as hyper-rural. One of the things we've learned from the SAEM conference is that we're not quite as facile at this as we were at in-person conferences. but we're getting better.
So while we're waiting for the audio to come up, let me ask the two of you a question, and that is, what drove you to the Navajo to be serving the Navajo people?
Mark?
I'm the easy one. I did my residency at Stanford and I got tired of treating rich white folk. Moved to Gallup, ran their emergency department for 3 years, and then moved to the University of New Mexico. UNM is on the public school teachers retirement, so you can retire early while you're still healthy and get a 60% of your pay for life. So I did that and immediately went back to work on the Navajo reservation. The other interesting thing is I met my wife in Gallup. We're both physicians. We've both been working on the res for decades. So that's how I got into it.
And Vicken, how did you get there?
Well, when I turned 65, I more or less got voluntold to retire. And I spent a year being very unsure of who I was, where I was, and why I existed without academic emergency medicine. So I looked for something else to do.
And so what's different about the Navajo reservation? What would you say is the biggest difference about them compared to, for example, the US system of healthcare?
It's complicated. They get free care. Aha, let's see if we can move to the next
all right.
slide. We're going to move quickly now.
Is some 5 to 6 years shorter than the US average.
So what is it now? Well, the tribe is very large. They have about 27,000 square miles. That make them by far the largest reservation in the United States. They have about 1/3 members, about half of whom live on the reservation. Reservation is very rural. It has 9,000 miles of unpaved road. Navajo continue to live in mostly isolated multi-generation households, although there's a tendency to move to more urban areas, places like Shiprock, Gallup, near the reservation. But on the reservation itself, communications is very difficult, as is transportation. About 40% of Navajo live on the reservation continue to haul water. They have to pick it up from outside the reservation or from water depots on the reservation, haul it in their pickup truck back to the camp. Electricity is mostly on isolated generators, although some of it is now being done with solar cells and windmills. Groceries almost all have to be obtained off the reservation. There are no major grocery stores except right along the periphery. On the res, there are 5 hospitals, but not all of them are fully functional. Some have inpatient beds but no staffing. Some have staffing but very few inpatient beds. Like I mentioned, much of the healthcare is not done by the Indian Health Service. In fact, almost all specialty care is done off the reservation in private or public hospitals. COVID care is done almost exclusively off the reservation once it becomes critical care. The hospital I work with in Shiprock only has 5 intensive care beds, and that is for a fairly large service area. Most of those beds were full before COVID hit, so many of the patients are transferred out. IHS also has a chronic shortage of providers. Many providers work after they finish their training for 2 to 3 years, as I originally did, and many of the other providers are people who come back after they're semi-retired, as I kind of have done.
This is Kayenta Hospital, where I work. During the pandemic, only department that was fully functional was the emergency room. We do have 10 inpatient beds, but no nurses to staff them. Other than that, we ran vaccination clinics for influenza and later for COVID. We maintained the pharmacy. Patients could come and drive through to get their medicines refilled.
Native Americans have some unique healthcare advantages, though, which I have to go over. First of all, almost uniquely among Americans, the Native Americans are essentially guaranteed health care. The obligations date back into the 1700s, But since the 1950s, the Indian Health Service has guaranteed health to everyone living on a reservation who has a tribal registration. Many of the Indian Healthcare Services facilities devolved to the tribes between the 1970s and now. So much of Native healthcare is now run by Natives, funded externally by the Indian Healthcare. On top of that, about 80% of the Navajo are also covered by Medicare, Medicaid, or private insurance. One of the problems with this is it's almost impossible to tell how much money is spent on Native care. So much of it is off the reservation or under other budgetary items.
COVID arrived in March of 2020 on the reservation with a vengeance. There were several super spreader events, the most well-known being the evangelical event. This was a typical revival, with everybody under a tent sitting close together. People had come from all over the reservation to take part in this, and they returned back to their isolated homesteads and their multi-generational houses. Then there was the Italian tour group. The guide had taken a group of some 10 Italians around the Grand Canyon, and they had toured in a small group. The Italians came down sick shortly after leaving the reservation. Meanwhile, the tour guide came home and infected his 5 children, who each got on their school buses and went off to their different schools. There were, in March, 10,500 cases, of whom 560 died. Thereafter, most new cases came in via smaller events. Since the reservation is dry, for the few Navajo who drink, bootleggers bring in alcohol, and those who drink it, many of them do not practice masking, distancing, or washing, as perhaps you might guess.
The tribe immediately started very aggressive public health service measures, kind of routine stuff. The reservation itself pretty much closed in mid-March. They closed the casinos, they closed the schools, they mandated self-isolation, they mandated health procedures that would seem trivial but turned out to be vitally important. Masks were distributed widely, hand hygiene, education, gatherings were limited. There's a huge push among the tribe to test, and approximately 100,000 tests have been done currently. They also negotiated with towns outside of the reservation, and Gallup, which was the largest town near the reservation, was actually closed between May 1st and 4th by government decree. That was the governor of New Mexico, and has been closed periodically since. Reservation has reopened periodically through traffic, but off again, on again closures have occurred since the initial one in March. The tribe has also been very aggressive about long-term planning and has put in multiple weekend curfews and lockdowns. These are the latest 2, but there have been literally dozens of these in place. I really think a major lesson from this is that leadership is critically important. President Nez has modeled safe behavior. I've never seen a picture of him without a mask on. They have been very careful about the edges of the reservation where the highest risk is. The tribe also has some built-in advantages, one of which is that it is a very, very decentralized democratic system. Each area has what are called chapter houses, where people are invited to discuss matters, and the discussions frequently take many, many hours. Everybody gets to speak, everybody gets input. The social structure is clan-based. Everybody has an interrelated relationship with every other group on the reservation and with every other individual. So people view everybody as one of theirs. I think importantly, the Navajo tend to value diverse opinions. That's why the chapter house system works. But behavior is expected to be unified. It's perfectly acceptable to think that wearing masks is not important. It's not acceptable to not wear a mask. You do that because you respect the opinions of the other people in your community. And the Navajo have what has been called a traditional being untraditional. I listened to an interview with Carlos Nakai, who is a registered member of the Navajo Nation. Carlos is a jazz flutist, and the interviewer said, but jazz isn't very traditional. And he said, but I'm Navajo, and being untraditional is traditional. That has meant that they have been very accepting of outside expertise and have basically been willing to change behavior.
What happened then? In May, you see that we had the first peak and then it leveled off. Again in the summer, when the res opened and then closed again, we had another peak. In the fall, when people could no longer stay outdoors day and night, the cases started climbing again. Shortly after the new year, the vaccine trial on the reservation started, and by March, some days were reported with no cases. As of the time of this recording, which is March 24th, there have been no new cases reported in the last 2 days and no deaths at all in the last 2 days.
What are the lessons for us? Well, the problems with Navajo are not unique. The major disparity in healthcare worldwide is urban versus rural. If you're poor but live in an urban area, you probably have a hospital within walking distance. If you're rich and live in a hyper-rural area, it may be hours. I'm currently living in Telluride, Colorado, which is a fairly wealthy community, but we're pretty isolated, and the nearest hospital is about an hour and a half away under the best of circumstances, and 3 to 5 hours away when the weather turns bad. Money can't solve all social problems, and I think that the trust, leadership, and the caring, the social contract among the Navajo is really what has managed to get them from a massive outbreak. At one point, it was the worst outbreak in North America, to a level that is much lower than any of the surrounding states. Well, what's the summary? I think the lesson for us Belagana is that trust is really crucial. You need to care about each other, and you need to care about the high-risk people. If you don't care about the elderly, if you don't care about the sick, they're going to get infected, they're going to die. You need to listen to the experts. You can't say, I'm going to do all the investigation myself on the internet, I'll make my own decisions. You need to listen to people who actually know more than you do, and that's hard for a lot of us. I think good leadership counts. I give a lot of credit to President Nez and to his leadership group. They've been aggressive, supportive, and have been really responsible, I think, for many of the things that were done on the reservation. You also need to move rapidly and aggressively, and the tribe did that. They closed the reservation early when the outbreak occurred, and they've closed it aggressively since then, even though that had a major financial hit for a population that is relatively poor. And you need to utilize all your resources. You can't withhold resources because you want to spend them on something less important. I think one of the things that has been really important recently is that the tribe has been aggressively counseling people and has been supporting things like early vaccination programs. They feel that normal vaccinations still need to occur, childhood vaccinations, etc., and they've been negotiating with the pharmaceutical manufacturers to be early adopters of experimental and then approved vaccines for COVID. And this is what the reservation looks like. This is actually leaving Shiprock, heading north towards the Ute Mountains in the high country. So Hagona, which is Navajo for goodbye, or quite literally, go in beauty.
Thank you so much, both of you, for this. This was absolutely wonderful. It's sometimes, I think, stunning to us to understand that there's another nation inside the United States. So I have a question first for Vicken, and that, and maybe you too, Mark, and that's what's happened since you've recorded. You gave us some good news. You ended on a high note. Have things continued good, or have things deteriorated again? Oops, you're on mute, Vicken.
I'm off, so I'll do it.
Okay.
It's brilliant. Basically, the tribe is completely vaccinated. Last time I checked, is over 80% of the population was vaccinated, and there's basically no more COVID. Very rare cases cropping up.
So clear. Go ahead, Vicken.
Some of the roadside stands that have been closed for the last year are starting to open up, but people are still very wary. Some people, as of at least 3 weeks ago, most people were still being very diligent about masking. The local supermarket in Kayenta is Bashas, and you practically don't see anybody in Bashas who isn't wearing a mask. The little roadside stands are the only income for a lot of families, and they have supported shutting down, even though it's really hurt their economy.
So we're a little over, but I'm going to take the liberty of asking one more question for both of you. Imagine that you're in an elevator with Biden and his entire entourage, and you have literally 1 to 2 minutes to tell him something from your experience on the Navajo Nation that would help our country get a little bit closer to the Navajo Nation. So what would you advise him to do? Mark, you're on first.
I think the key message is that you need to care for people, and that isn't something that really came across early in the Belagana community, and it really hasn't come across that much now either. You don't have to make your own decisions all the time. I don't think anybody doubted that there were going to be a bunch of deaths among old people and older people in nursing homes and immunosuppressed people and an occasional healthy person. But somehow this became a political football, and those people simply didn't count. In the Navajo, those people counted.
Elders are considered a treasure, and the Navajo protected their treasured elders, they protected their families, and everybody who is Navajo is family. Everybody is a member of one tribe or another. You don't introduce yourself as I am and I do, but rather the name that I use is this, and I belong to this clan. My father belonged to that clan. My mother's clan, my mother's clan goes back into antiquity. There's occasional men that marry in, but I belong to this clan.
Yeah.
Everybody's family.
Yeah, I think the other thing that I took aside was the fact that they have chapter houses, and I am aware of those because I was on the Navajo reservation for a very brief time, way long time ago, before most of the participants here were probably even born. The fact that they can talk and disagree and not get into fights and be able to remain friends and come out unified, I think is one of the strengths of the Navajo Nation. I see no other questions. Again, I thank you, and I thank you for your service to the Navajo people and to our country.
Thanks, Sandra.
Can I ask a question really quickly before you all log off?
Go ahead.
I wanted to make sure everyone had a chance. Hi, I'm Keely. I'm a MS3 this year. I was just kind of wondering, at this med student level, how do we get involved in kind of caring or helping care for Navajo Nations? And I remember you were mentioning the Hopi people at the beginning. I don't know if you all have any suggestions on kind of ways to learn more or get involved.
Well, the one thing that's, go ahead.
University of
Mark.
New Mexico, I'll turn this over to Mark, has medical student rotations for that.
Yeah, the most of the hospitals have access for medical students. Shiprock, if you call up Shiprock Hospital and ask to talk to the emergency department, they run medical students through. I know that they do in most of the outlying hospitals as well. So you can arrange a formal rotation with supervision that's approved by certainly the University of New Mexico, because we did a lot of that. You can get some training and get credit for it, and it's an amazing place to work.
Yeah. Are those rotations open to students that aren't at University of New Mexico?
Correct, they are. Get in touch with the hospital first, but you can probably get credit either from UNM as an outreach or from your home institution. Where are you now?
So I'm currently a student at Turo, California, but I live in Las Vegas. My husband's in the Air Force, so I've been doing all my rotations in Las Vegas this year. So kind of neighbors to Arizona and New Mexico a little bit. But I'll look up Shiprock Hospital, and I'll look them up on VSAT, see if I can find anything.
I would check with the Hopi Reservation as well.
Okay.
Hopi Tribal Health is in Palaka. I'm actually supposed to be out there next month, but I haven't rotated there yet, so I don't know much.
Okay. Perfect. And just if I search I'm sorry, you said it was the Hopi Health Service?
Yeah, if you just put in Hopi Hospital, you'll probably get it. It's in Palaka, Arizona.
Wonderful. Thank you. I appreciate those leads. I'll track them down, see what I can find.
Well then, I guess that's it. Goodbye, everybody.